Thank you. So just to give you a brief background, we are the first business school in the world that's totally dedicated to educating the next generation of health and healthcare management leaders. We are sort of coming with a very innovative concept to reimagine global healthcare management. And what we're trying to do is to unravel healthcare challenges from a business perspective. Now, on this slide, we've put a picture today here of the cohort who have just started our inaugural cohort on the business program MSc this year. And we've got the 3 routes in that photo where we've got at least 50 students per route who have just started on the program. And they're really having a wonderful time going through the program and learning on the different routes that they've been chosen for their studies. What we try to do with our curriculum in the business school is to question the status quo in healthcare management and also to inspire the overall public good. Now, in terms of the routes, we are providing an understanding of the contemporary landscape. So we kind of looked at the way the healthcare challenges are going within the landscape of healthcare service provision and health systems. And we're looking at the sort of key leadership and management skills that are required. And we've designed a curriculum for the 3 routes that provides you the opportunity to learn theories, principles, and practices that make up healthcare management as a discipline. So additionally, you will learn to kind of look at these topics with a global lens. So kind of looking at it from a vantage point of, what you know about healthcare from where you're coming from and what obtains globally across the globe, learning from experiences of your colleagues, learning from the literature, and also using the UK NHS healthcare provision as a standard or as a flagship within which you sort of evaluate all of the different dynamics and the differences that go on in global healthcare service and health provision across the globe. So we try to understand how healthcare management varies between countries, systems, and cultures as we go through the curriculum in your learning. And we provide principles of quality improvement, patient safety, as well as giving you the foundation on how to manage a diverse workforce. So these are some of the key things that you would learn about when you come on board the program. Most of our students predominantly do not have a basic core healthcare background, but are really interested in working in the field of healthcare, be it for healthcare management or for consulting processes. So you will have the opportunity when you come on board the program, irrespective of those backgrounds that you've had for your first degree, to study in depth on a topic of healthcare management through any one of these 3 routes, whether you choose analytics, finance, or leadership. In terms of your entry requirements, when we look at the sort of students that we take on board the course, as a minimum, we would expect that you would have studied for a degree either in the UK or elsewhere in health, science, social science, business, or have an overseas qualification minimum of a 2-1, relevant degree, or with extensive work experience, and we would consider your application. So in terms of your language requirements, we require that you have an IELTS score of at least 6.5 and above, okay? And with no less than 6.0 in the sub-test. Your personal statement is one that we look at when we make our choices about who joins us on the program. So do take time to craft those statements carefully. And also we require that you provide at least 1 reference, someone who can talk about your accomplishments academically and your character as a person. Now, who is this program for? So again, just to highlight, for individuals who strive to become excellent managers and change makers within healthcare settings, you may be new or a recent graduate in health sciences or in the business field. So some people even have an engineering background in our cohort, but they're truly interested in health or have done some work placement in health and gotten a keen interest in different aspects of health. So you may have some relevant work experience in healthcare that you want to build upon or take your career to the next level. When you join us for the induction day, we provide a 1-week length of induction program, which really enables you to focus on your personal and professional development, to think about some of the things that you need to go through the program. And we really design a program of sort of exciting, engaging activities throughout that 1 week. Students are invited to complete an unassessed self-paced course on global health, just giving you a kind of world view about global health issues. But we're not assessing those, but it's just to give you a brief background and a brief knowledge of the expectation when you come on board the program. Now, Term 1 on the program will provide you an advanced understanding of business and management for health, where you will have 2 modules that are core, and then you have 2 other modules from a chosen specialism. So if you're from the analytics route, you have 2 additional modules to your core. If you're from the leadership route, you have another 2 additional modules, and you're for the finance module, you have 2 additional modules. So each route has 4 modules in the first term. Now in term 2, we give you specific tools within the global health landscape. So you get 2 again modules and another 2 modules for your specialism. And then you go on to term 3, where each person has 2 projects, 1 research project and a business project. The business project, where you'll be put into groups of 5 to 6, and you would work across the 3 routes in those groupings, and you develop an idea for healthcare improvement from concept to business case. So you'll be expected to produce a business case and do a presentation, and then also do a 360-degree feedback where you kind of evaluate each other. And then for your research project, you pick an independent topic of choice, a topic that interests you as an individual, and combines learning from throughout the program. So when you come on board the program, we'll give you some initial exposure to how to find literature, how to develop a research proposal, how to develop a research question, and how to craft these accordingly, and how to do good research. So when you come on board the program, you get all of these building blocks, and you'll be expected to do 1 research project on your own on a topic which you are passionate about. And you will turn out that report for your final assessment as one part of the final assessment, and then your business project as the second part. So when we talk about how we fund studies, most of our students usually come self-funded, but we do have on the program opportunities to apply for scholarships and funding. Now, some of the funding and scholarships are listed on this page, where we have Women in Healthcare Leaders Scholarship of up to £5,000 for female students who demonstrate leadership potential. This helps to prepare students to move into sort of senior management roles and C-suite roles. So you can kind of apply for some of those funding if you've got the experience to suit. And then we also have the Global Healthcare Leaders Scholarship, which provides up to £5,000 in funding. So these are some of the funding that we have available within the university that you can apply for when you come on board. There are also wider sort of funding that you can tap into when you come on board this program. For example, for those in the US, you can go for US federal funding. And then for those in the UK area and even in the US, there's the Chevening, Commonwealth, Fulbright Scholarship, GREAT, and the Master's bursaries in the UK. So there is a link in this slide, which you can kind of use to access more information about scholarships and funding. And feel free to drop our administrators any questions if you've got any questions regarding any of the university-based funding that we offer. So by way of career support, we usually emphasize to our students that once you join the program on the very first week, we emphasize that your career aspirations and your job search start on the first week of joining. So we don't wait for you to finish your MSc before you start looking for a job. Straight away, we start to expose you to career coaches, industry mentors, and industry events. We start the week of induction by exposing you to lots of the mentors and health executives on our program. We have good talks where we invite distinguished speakers from outside the university. And then we have career support activities where we talk about building your personal brand, developing your CV, and learning to network online and so forth. We also give you access to all of UCL career services Innovation and Enterprise Services, as well as the UCL Alumni Network when you complete your program. So these are some of the things that you will tap into when you come on board the program in terms of leveraging your experience and your expertise for the next phase in your career. So when we want to think about career destinations in terms of what you want to do when you finish your MSc with us, some of the very popular aspirations and destinations for our students are in health consultancies with the big four consulting firms, or going into management roles within big pharma, or working with other companies in the pharma sector and the wider sort of health tech and med tech startups. So these are just some of the areas that people kind of aspire to be in. And also there's the wider sort of the NHS, academia, and international organizations that people aspire to join as well. When you join the program, one thing that you will not lack really is extracurricular activities and student support activities. There are tons and tons of activities that you can take advantage of. There's the Student Union. There are over 250 clubs and societies, around 70 sports clubs. We have volunteering opportunities. We have student support and well-being team to work with you if you need any support. And we also have a student union advice service as well that kind of helps with anything student related that you might have issues with that you want advice on. Thinking about life at UCL East, which is our main hub where we are based and operating out of for delivery of the program and for student experience, we have state-of-the-art facilities in the heart of the Olympic Park in Stratford, East London. It's an exciting new student accommodation experience in London's vibrant East End. And you have the East Bank cultural and educational destinations around there. And you also have good food and shopping destinations. It's about 8 minutes walk from Stratford to St. Pancras International. And it's quite central. You can easily get from the DLR link, you can connect to any part of London within 20 minutes, really. It's got good sports facilities as well. For those of you who are really avid sports members, you can use the park to access local venues, including the London Aquatics Centre and Cooper Box Arena. So lots of activities for you to take advantage of if you come to UCL. And we've got two buildings, one building which we are using at the moment, and then the other building which we'll be moving into next year. So two massive buildings with state-of-the-art facilities which will provide the best experience ever for students. Life in London. When you think about life in London, there's so much to see and do in London. So we have the Bloomsbury Centre, which is the home of UCL. So the headquarters, the main building of UCL is situated there. And you would from time to time get to do some of your courses and induction activities in some of those locations in Bloomsbury. Whereas the business school, most of our learning will then occur in UCL. So you might find yourself occasionally traveling to Bloomsbury campus, but it's a very short travel, easily done on the underground. And then of course, lots of tourist attractions within London, lots of sports events and facilities, lots of parks and greenery, lots of festivals. For those who like the museums and the galleries and the institutes to visit, there's lots to see and do. And of course, good food in pubs and clubs for those who like the nightlife when you study. Generally, London is ranked as the top city for London students in the UK and all over in the QS rankings for 2021. So just to kind of highlight some of the upcoming events that we've got coming up, we've got scholarships and funding information session on the 10th of November at 12 p.m. GMT. And then we've also got the MSc Biotech and Pharmaceutical Management Open Day coming up on the 10th of November as well. And then we've got the Digital Health and Entrepreneurship coming up on the 17th of November. So feel free to attend any one of these programs to find out more about the program, more about funding opportunities so that you can decide on what the best line of action is for you in terms of program of enrollment. And we look forward to hearing from you in due course. I've put here some details around how you can find more about the Global Business School for Health and how you can contact the admissions group if you have any further questions. Feel free to email your questions and we'll try to get answers to you as soon as possible. So again, I'll say put your question and answers in your questions in the chat box here and put your name by your questions. And I shall just take time to go through some of the questions before we finish today. Thank you for listening. Just going to pause for some questions. If you have any questions, you just drop them in the chat box. Okay. So Ivan, you said, for entry requirements, I did a medicine degree in China, but my institute is not on the UCL school list. However, I have 3 years work experience in a medtech German company. In that case, do I meet the entry requirements? So you've got good work experience and you've got basic medical degree. So I think what will be useful for us is to see what your degree is classified as. So I would say get in touch with the admissions office and provide the information of what you've got, Ivan, so that we can have a look at it and get back to you about whether or not it fits, if it's not on the UCL school list. Okay? And Raneem, you were wondering when you should expect to hear back regarding your application you submitted about a week ago. So for those of you who have applied, we're starting now to look at applications. So I would say give or take the next sort of 3 to 4 weeks, you should be able to hear something back. But I would say don't fret. You've applied in a good time, early enough, so we are on it, and we've received quite a number of applications, so that's fine. An anonymous person is asking the percentage of Chinese students on the program. We have quite a significant amount of Chinese students in this current cohort. I think over 50% of our student cohort are actually from China, which is quite a sizable amount. But generally the other proportion of students are really from a sort of global landscape. So we've got students from the UK, we've got students from Canada, students from the Middle East, students from Asia, students from India, Pakistan, and even the far, far, far east. So we've got a good global pool. But yes, at least 50% this cohort are from mainland China. Any other questions? Okay. So in a cohort, we accept, at the moment, we are capped at this particular session, we capped at 50 per route. So the entire cohort across the 3 routes sits at 150 roughly, just slightly under 150. So we divide you up into the 3 routes and it's 50 per route. And that's the way it's working at the moment. Okay. So you submitted your application on the 10th, on the 18th of October and received an email telling you that your application is under review on the 28th. I'm wondering when you're expecting to receive the final results. So again, I will chase up with admin to find out what the timelines are exactly, but usually within about 4 weeks, maximum 6 weeks, you should be getting some feedback. So we would find out, what the process is for you to hear back, okay? Yes, Raneem, we've got quite a significant amount of nurses. We've got nurses and doctors on the program who want to learn about leadership and management. And I would say what I would emphasize to you is that we have got a really global perspective on leadership and management. So we're not a UK sort of focused curriculum. We've got a global curriculum, hence the name Global Leadership and Management Program. So yes, we do have nurses and doctors on the program, and we also welcome those whose background are not necessarily core medics. So we've got allied healthcare professionals as well, even engineers, and those who have got analytics background but interested in working in health. So the program, the curriculum is shaped in such a way that it gives you a really broad perspective as to different aspects, things like risk, economic evaluation, leadership and management, making change in healthcare practice, and also looking at health systems. So it gives you a really good foundation. It's quite a rich curriculum. If you look through the program, you will see that it's quite a rich, varied curriculum, which builds you up as a leader in healthcare. Okay. Yes, I think you can send your materials, Ivan. Send your class of degree. Tell us what you graduated with and the name of your university, the details of that, and we would have a look. If it's not on our list, we'll be able to advise you accordingly to see where you fit. Okay. How can we expose more diversified study environments if there's so many Chinese students? So we've got over 50% students from mainland China. When you talk about diversified study environment, we welcome students from every part of the globe. It just so happens this year, in our inaugural year, that most of our applicants were from mainland China. So what I will say to you is, regardless of whichever part of the world you are from, do apply for the program. If you meet the standards, you will be admitted regardless of what part of the world you're from. It's a global program, open to a global cohort, and the one thing we are teaching our students is to be adaptable and to be accommodating of different cultures. Okay, so one way to be diversified is to be used to people from different parts of the world, and that's the one message that we give to our students. So we are really open to anyone from any part of the world. Language requirements. Can I use the UCL pre-sessional English course as my language results for application? How can I enroll in the pre-sessional English course? So I would say email this request, this question now to the admissions office so that we can clarify that for you, because I'm not quite sure where the pre-sessional English course sits in terms of measurement of standard, and whether or not that course has an assessment at the end allows you to use that. Okay, so email our admissions department, Ivan, to get some feedback on that. Otherwise, we would go with the standard IELTS scores as an admission criteria for test of English. So when we do group work, we will basically go by arranging you into groups that cut across your routes. So we don't necessarily go checking what country you're from. What we make sure in our allocation of grouping is that you are cross-grouped across different specialties. So for example, if you're on the finance route, you will have at least one person on the leadership route, you'd have at least one person from the analytics route in that group. So we don't go checking, okay, if we have one person from China, then we have one person from the other country. To some extent, we can balance that, right? So it does work out that way to some extent, but we are not really fixated on, because we do get you get a vast amount of exposure to work in different groups across the program. You will find that different modules have lots and lots of group work going. So whether or not you're working with someone in one country in one group, you will get to meet people from other countries in another group. So one thing that was really evident this session, every time the students come into class to learn, we arrange them into groups. So for example, every week on my module, which is the leadership module, students get to work in different groups. And when we mix them in a group today, when they come to class, that same class next week, they don't get to work in the same group. They meet a whole new different set of students. So yes, in a sense, you will get to meet as many people as possible throughout the course. We don't just leave you bunched up with your friends or, linking up with two familiar faces throughout the program. Okay? Yes, it is interesting. Thank you, Ranim. So yes, another thing we do, we have a local partnership content where we bring in lots of experts from in and around London. So we've got like a lecture series that we run on the program. Speakers come in to talk about different aspects of their research, of their work, to give students that exposure. And then of course we have the Careers Advice Center that advertise internship opportunities. So yes, you will have opportunities to do internships if you're interested in internships. We've got the career services where they advertise all of these internships. And even on the Global Healthcare Management program, we have opportunities from two key organizations like Economist Impact and PATH, who have offered us internships which we are giving to our best performing students at the end of the course. So at the end of the course, we're going to select 3 students each for each one of those organizations and recommend them based on their overall performance to go and work with these organizations once they have finished their project. So there's lots of opportunities for exposure to get to work with organizations in London. We have the careers fair, which you can take advantage of, and lots of companies come there to advertise and talk about their work there, and you can get to meet them, talk to them. We even organize sessions around how you brand yourself, develop your CV and develop yourself, your personal brand, in anticipation of meeting with these individuals from these organizations. And then you get to meet industry experts who are affiliated with the program by way of health executives in residence and mentors. And you can ask questions and get to know what it's like to work in those organizations. So each term has 10 weeks. So we've got 5 weeks in the first half of the term, and we've got a reading week in between where there's no lectures, and another 5 weeks, and then you write your exams. And then of course there's a break. So for example, we finish on around about the 13th or 14th of December, and students get to write their exams that week, all that week into the next week, and then they go on their Christmas break for the season and come back early in January. Yes, there is a vacation break between each term, basically. So, I mean, when we say relevant and extensive work experience, we're looking at work experience that might be internships within the health field. I would say anything that goes on for at least 6 months to 1 year, with good work done and experiences that can be itemized. We would consider these for what it is. So basically, if you've got experience working interning in an organization or working full-time in an organization, when you write up your CV, you need to highlight these. You need to highlight in your personal statement why you think you should be considered for a place on our program, and we would evaluate your work experience and your foundational degree as well, Susanna. So that's basically it. Okay. Any other questions? Okay. I'm going to say thank you all for coming and thank you for listening. It's been really lovely having you asking lots of interesting and engaging questions. For those who I haven't answered the questions around, where your degree is from and how it fits into the list of requirements, I would say email the administration office so that we can look at what you've got and assess that and get back to you accordingly. If there are no other questions this morning, I would like to say thank you for coming. Looking forward to getting your applications. Do apply early because the places are limited. So we do have a very quick rush in the application process, so to say. So I would say send your applications in sooner rather than later so that we can start to have a look at these. Okay. Okay. Thank you all very much. Have a good day.